Time now for our MU Healthcare segment. Here we do this during every single Thursday during the high school football season, and the reason we do that every Thursday is because there's a lot of stuff going on, and they can also help you take care of some of the things that didn't go quite as swimmingly for you on a Friday night or during the basketball season. Now they've got the last segment or healthcare clinic this Saturday. Those always go from 9 to 10 o'clock, and they're over at Missouri Orthopedic Institute, and it's a walk-in, and they're able to do some initial assessments and then also get you referred as well. So it's a fully staffed clinic. So and the best part is it's a free one. So get on over there after a Friday night. Don't let whatever's happened on Friday linger through the weekend. It's your chance to get the jump on things. Joining us this time around is Dr. Luke Stevens with MU Health, and you do asthma. So let's get it kind of right out the front here. What is the medical definition of asthma versus what people normally think of? Oh man, I'm short of breath, must be asthma.
Yeah, thanks.
You can pull that microphone up, by the way. That thing moves. That way you're not seeing the chiropractor later.
Thanks for having me on the show, George. Always a pleasure to be on. So when we talk about asthma, the medical definition of that is going to be an inflammatory condition, inflammatory disease, chronic illness that affects the airways. There's many different phenotypes of that. The one that we think about in sports medicine is exercise-induced, but obviously we take care of the general population too. And so it's an inflammatory condition that affects the airways. It can have many different triggers.
Okay, so you mentioned exercise-induced. We've got cold weather on right now, and apparently that microphone will not behave. So weather-induced, cold-induced asthma, exercise-induced asthma. What other types out there that you deal with, not just with the athlete, but with the common person?
Yeah, so in kids, we'll see what's known as atopic asthma, which will run along with some skin conditions. We'll see commonly in the spring and summer, fall seasons, some allergic asthma, which has triggers, pollen. We all love our ragweed here in Missouri, so that's another common trigger for that. And obviously there are other conditions, environmental exposures. So you'll see some in your grain workers, people who have those environmental triggers. As you mentioned, cold air is a big trigger. In particular, when you have cold air, you have dry air for the most part. So, here in Missouri, we like our heat with our humidity. So, but in the winter, you lose all that nice moisture. And so that's both indoors and outdoors. And that's a common trigger as well, too, is cold air, but dry air. And in Missouri, we have both of those together.
So if you're a runner, then is one of the simpler solutions run with a mask?
Yeah, so masks have been actually pretty effective when it comes to that, because that traps in the humidity in particular. So one of the functions for our nose, other than just for smelling, is actually it's a humidifying device. And so when you reach a certain ventilation, a certain volume of air that passes through that, you exceed the capacity of the nose, and so you start breathing through your mouth for the most part, which then is naturally drier air. And then as you do that, you continue to do that, the air gets drier and drier and drier. So a mask will actually trap some of that humidity in there, and actually has been pretty effective to reduce, in particular, asthmatics, but also athletes who have exercise-induced bronchoconstriction. So it is quite effective. So,
Dr. Luke Stevens, Missouri Health, and don't forget about their clinic this Saturday. It's the last one of the season, but it's from 9 to 10 a.m. over at Missouri Orthopedic Institute. Good place to get started on what may or may not be wrong with your athlete. If there's nothing wrong, good on you, but if there is, it's a great place to get started. Asthma is our topic here. Besides rescue inhalers and medications, are there things people can do, athletes or otherwise, to kind of mitigate their asthma, besides moving?
Yeah. So a common misconception among asthmatics or people who feel they may have asthma is that exercise is going to cause my symptoms, or exercise is going to make my asthma worse, when in fact the exact opposite is true. Being active, exercising is going to increase your lung capacity, is going to decrease your symptoms over time, and so staying active is a very vital part of that. And that's why as healthcare providers, we want to really incorporate exercise as medicine when it comes to our asthmatics, and even athletes who have lower forms of respiratory disease. So staying active, staying exercising, really important things. Actually, in some athletes who get triggered by exercise, if they have a really forceful warm-up prior to their game, so a good, hard, high-intensity exercise 20, 30 minutes before their basketball game, say, for example, will actually mitigate the onset of those symptoms. And so the opposite of what is commonly done out there is actually true. They'll be afraid to exert themselves until game time, but you should actually do it 20, 30 minutes before, and that can be quite effective.
Okay, and then it actually ends up being worse during the game time, because now there's the additional stressors of the game itself.
Yeah.
Okay.
Plus the psychological load comes into play a little bit, especially with your high school athletes.
Yeah.
So,
yeah, a little bit. We've seen it with the college athlete as well out there. I know there are a huge number of things, whether it's available over the counter or by prescriptions for the layperson as an asthmatic. What about the athlete? How do you handle that? Because I've seen that poster, and it's a lot of tiny, tiny print on a very large piece of paper. So as a physician, how do you handle the difference between the athlete versus the regular person or the weekend warrior?
Yeah, I mean, it depends a little bit on the level of the athlete. So when it comes to NCAA athletes, we have to be very, very cautious when it comes to over-the-counters, when it comes to anything they might find on the internet, because some of those can actually test positive. Some of those, I have a positive drug screen, is truly I was taking it over-the-counter that had another agent in there. And even common medications such as albuterol can trigger a positive test, and that's why all NCAA athletes, Olympic-level athletes, have to have a waiver when it comes to those. So we want them to use those medications because they are effective, but you have to have the correct diagnosis. And so that's something we do during preseason physicals, is to make sure that's appropriately documented and been tested for. But yeah, definitely education when it comes to what's out there and what's available, and how dangerous that can be to them, but also their careers and how that can impact it.
When you're working with them, with the athlete, then does it matter generic versus name brand when you're looking at the ingredient list? Because it's not the active ingredient, it's all the filler that's added.
Not so much. I mean, as long as they're paying attention to the ingredients, and as long as it's an FDA controlled substance, that's a really important thing, is because supplements and vitamins and all those other things that are not FDA regulated will appear to be FDA regulated. And so you really got to look into that and make sure that it is what it is. And that FDA regulation, that's one thing the government actually does pretty well when it comes to those things, and can make a huge difference, because again, careers can get derailed. There can be some bad adverse events that happen because a lot of our athletes also consume caffeine and other substances, and the combination of those can really be dangerous. So.
Well, and for the NCAA athlete, it's a 1-year suspension. Yeah. And that counts against your eligibility as well. Dr. Luke Stevens with us, Missouri Health. Okay, so when you're working with the athlete, let's work through that process then. You meet with the athlete, you meet with the parents, diagnosed as asthma, exercise-induced or otherwise. How do we handle now the rest of that, the treatment versus the mitigation?
Yeah, so one of the bigger points to make is, do they have symptoms only during sports, or do they have symptoms just with basic activities? That big distinction of, do they have asthma, which is that condition you can walk around with and impacts all aspects of life, or do you only have what we define as exercise-induced bronchoconstriction, which is really the absence of that asthma, but asthma-like symptoms. Okay. And so if they have asthma where it affects them, hospital admissions, causes problems just on day-to-day activities, we need to control that, with controller medications that are going to take every day, dose that appropriately, follow those symptoms, see how they're doing, how often they require the rescue medications. On athletes that only have it during sports, then it is thinking about the appropriate warm-up, use of that medication, timing that for their sports. What's the length of the sports? You may approach a soccer athlete different than a basketball athlete, than a baseball athlete when it comes to those activities. So really working with them a game plan of identifying their symptoms, following their values throughout the year. So that's a big distinction, though, is, do they have asthma symptoms outside of sports or just during their sports? So.
Is it easier to get the medication waiver if they're diagnosed with asthma versus exercise-induced asthma?
Yeah, for the NCAA waiver, it requires a formal diagnosis. And so they don't give a lot of specifics in exactly what that means.
Of course not.
But yeah, so they kind of leave that up. But, we do a really good job of making sure we have the appropriate diagnosis, because it does impact what medications, how are we going to approach this? Are there alternatives to those medications? That's one of the things the NCAA requires. When it comes to albuterol, there's no real alternative when it comes to that. So you want to make sure that diagnosis is correct. And again, if it's an asthmatic patient, usually that's going to be done with a pulmonary function test, which is very commonly available. If it's only during sports, though, you can do an exercise test to really measure their FEV1 before exercise, after. Pretty simple test, but can really be useful to seal down that diagnosis.
When a common person or an athlete is suffering from an asthma attack, what exactly is going on in the body, and can it differ if you're an athlete from a regular person?
The basic physiology there is going to be very similar. The difference that you're going to see in an athlete is they're usually going to have a lot larger lung volume, although that's different based off the height of the athlete. Some other factors will go into play there. So the difference with an athlete is that sometimes they'll have more reserve. A lot of times they'll have more reserve, and they'll actually let their symptoms get along a little bit further. And so sometimes that can actually be more dangerous. Whereas does. And also they push themselves to a higher volume, and so higher lung volume. And so their symptoms may present a little bit differently. They may not identify their symptoms, may used to be that mentality of I'm going to push my way through this. And so they can present later in those stages. So you always have to be on the alert and ready for that. The approach in terms of an acute asthmatic event is going to be to really the albuterol, that quick-acting medication. Sometimes in severe situations, it does require additional, more urgent medications, steroids, things along those lines to get that turnaround. And some of our asthmatics, certainly in the winter months, are going to require IV medications to address their symptoms. So
that's Dr. Luke Stevens, MU Health. Don't forget their clinic this Saturday, 9 to 10 o'clock at Missouri Orthopedic Institute to get that first step in the diagnosis. And folks, if you think it's a concussion, get it checked out. Don't wait and go, no. When in doubt, get it checked out. Something that, as you were sitting here kind of cooling your heels during the news and our discussion about Kansas City Royals baseball, the vaping stories were really bang, 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 bang. And I wanted to talk about this for the last couple of minutes of our segment. It's not sports related, but it is incredibly important, everything that is coming out about vaping. From your point of view, sports medicine, asthma, all the rest of that, where is vaping and what's happening with this now?
Yeah, so we know that it's a dangerous substance. There's no question about that whatsoever. And the damage that it does on the lungs is unquestionable. The tough thing is there's so many different varieties out there that it's really tough to decide, how quick can that damage come on. We were talking earlier, the state of Missouri is requiring physicians to report vaping lung-related illnesses, and that's been going on since August. The state of Missouri has already had a death that's been clearly linked to that based off biopsies. And so that really dangerous. It's a little bit of an unknown. As physicians, we struggle a little bit with, how dangerous it is, but it does appear to be pretty quick in terms of its onset and can really be disastrous, especially to a set of young lungs, even old lungs in terms of that. So it does appear very, very dangerous. We're working really hard to try to figure that out more, get more data on it would really be important. So,
are there any groups or lifestyles that are more susceptible to this?
Yeah, so certainly, younger populations seem to be more likely to consume that, and that's because of availability of it. The state has done, federal government's done a little bit to trim that down a little bit, which is nice. I think that's very important from a public healthy standpoint, but certainly those younger populations seem to be just more susceptible to it, and unfortunately, smoking rates were really seeming to be headed in the right direction until vaping became more popular, and now we've seen a reversal of that. And so, this is a new challenge that we have to face and really get a handle on. So.
Yeah. And I know this is totally off the sports topic, but this is really important. So at the end, we'll leave it with this one here. Don't forget about the clinic on Saturday, 9 to 10 o'clock. It's over at Missouri Orthopedic Institute. Concussion, make sure when in doubt, get it checked out. What do the symptoms present then to a physician for somebody who is in danger of being hospitalized because of vaping?
Yeah, so in addition to coughing, difficulty breathing, the other symptoms that have been associated are really intense fatigue with an acute onset in particular, malaise, joint pain, things like that, which you wouldn't necessarily expect with, say, a smoking-related illness. So those are the other symptoms to really pay attention to, is just feeling off or different overall, and that's the effects on it on the body. So it really can affect the cardiovascular system. Increased heart rate is another one too that's a little bit unique to that particular illness. So really reporting those symptoms, paying attention to those symptoms, getting early intervention is really, really helpful. So.
How quickly can this overwhelm the body?
So again, with the lungs, the tough thing about the lungs is
you kind of
burn
need them.
through. Yeah, well, they are pretty vital to life, it turns out. But you can burn through a lot of your reserve and not notice it. Really? And so again, athletes notice their symptoms a little bit earlier because they're pushing themselves hard, but just getting off the couch to the bathroom, if you're having symptoms, right, you're probably pretty far in your reserve already. And so that's the thing, is that collapse when it happens can be when already the majority of the lungs are affected. And then that's when it can turn deadly really quick. Okay. And even I think the case that happened up in Mercy with vaping-related illness, that individual was in the ICU, was on ECMO. They were doing everything and intensively trying to help that individual, and it just didn't work out. So it's a really, really bad thing.
You're basically, with this, you're cooking your lungs.
Correct. Yeah.
More so than
damaging.
Cigarettes.
Because again, if you superheat a liquid and breathe that into your lungs, there's likely some damage that's going to occur, and that can really be disastrous. And the ability of the lungs to recover is remarkable. However, sometimes that damage is permanent, and it can be overcome even with the best of interventions.
Okay, I want to wrap it up real quick on this. As a parent, you mentioned this happens a lot with the younger people, and some of the ages that we're seeing are well under that 21-year age. So as a parent, what are some of the things that you're looking for with your kid with the vaping-related illness?
Yeah, I think the big thing is talking to your kids about that. Having an open channel of communication. You can't help them unless they're willing to talk about that. So, communication is really, really important. Please utilize your physicians and your resources, your pediatricians, your family physicians, reaching out to them to really, sometimes it's nice for a physician to be a bad guy when it comes to that, or make it be our idea. It's not your parents' stingy idea that that is bad for us, but let us get them the facts there, because we want to make sure that they don't damage those lungs and get to them early. Stop that habit before it gets too far down the road.
All right, Dr. Luke Stevens, MU Health. And again, don't forget about the clinic on Saturday for the athletes, basketball or football, 9 to 10 a.m. over at Missouri Orthopedic Institute. Doctor, thank you for the time. I really do appreciate it, especially the vaping. I know that was a little off field, but we did all right with that, right?
Yeah.
Okay.
No, I think that was great. And we take all athletes.
Yeah.
So at the sport injury clinic, took care of several last week and went very, very well. So.
All right. Very good. Very good. Thanks again. Appreciate it.
Thank you.
The Closers on KFRU and KLIK.